What's going on, everyone? Happy Thursday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Pandemic Update for Thursday, February 22nd, 2024. If you're new to my channel, this is where we do the daily pandemic update on, yes, that virus, COVID. It is still an issue all across the country and really around the world. There's also a lot of other viruses out there that are issues as well and can be a threat to your health. If you want to stay informed on what's going on with all the different viruses, hit that subscribe button down below. Give this video a thumbs up and share this with anyone you know. Alright, starting off today, the Ohio Department of Health reports flu cases are on the rise statewide. Ohio is currently listed as very high for flu cases according to the CDC. This is not good. We're seeing a number of places that have actually gone up again for flu, which sometimes can happen late February going into March, but Ohio is particularly getting bad now. Columbus, Ohio. The Ohio Department of Health held a press conference on Thursday to update where the state stands regarding COVID-19, RSV, and flu cases. If you've been following my channel long enough, you know Thursdays we usually get some sort of an update out of Ohio for COVID, but it looks like they also updated about flu as well. It says flu cases on the rise. Influenza activity in Ohio has not been relatively high as the numbers are on track with the 5-year average statewide. So they're saying it's not relatively high, but again, we're going to go to the CDC flu page. Matter of fact, we can do that right now. A look at Ohio on the CDC flu page, and you can see they are still in very high category, as is a whole bunch of other states. You can see here Texas, Arkansas, South Carolina, even some cities. Look at District of Columbia and New York City. Still at very high levels of flu. Wyoming, state of Wyoming, you're still at very high levels. Then there are a whole slew of other states that are still at high levels, and not too many states right now are in the minimal category. There are a few of them, though. Vermont is one of them, Alaska, and then even Nevada, believe it or not, is minimal, and Utah is at the lowest level of minimal, which that is very impressive, to say the least. All right, continuing on now. Speaking of Northeast states, we just mentioned Vermont. Well, in the Northeast, there's something that's not doing too well. That would be Norovirus, contagious stomach bug circulating in the Northeast. Know the symptoms. Doctors say one of the biggest things to watch out for with these illnesses is dehydration. So yes, we are seeing an increase in norovirus, which is ongoing across much of the Northeast states, and it is really taking off in New Jersey. We're going to take a look at some wastewater data today. We'll see what the wastewater aspect shows in terms of norovirus, and we always do look at norovirus when we look at the wastewater scan site because it listed, and we can look at it around the country. But yes, right now norovirus is rising, and look at this graphic right here this is from 6abc.com. It's a local news station here in Philadelphia, and you can see here that the test positivity rate, wow, 15.4% positivity rate is being shown up there for norovirus right now. That is really high. Now we go on to this. They just had Mardi Gras in New Orleans. Well, there's another issue. You might think, oh, well, COVID's going to rise, flu's going to rise. Yes, maybe. But how about this? 2 more cases of measles, this time in New Orleans. 2 cases of measles in kids confirmed in the New Orleans metro area, first since 2018. So this is not good to see. If you want to learn more about this, I did tweet this out on my Twitter page at COVID data report. Then we come to this from Dennis, the COVID info guy. How repeat COVID infections can harm your health. We know about this, but there's some more news on this. Doctors say there's evidence that repeat COVID infections could increase your risk for many other health problems, including diabetes, heart condition, gastrointestinal diseases, and long COVID. Yep, we knew about this, but this is just reinforcing what we know. Again, I retweeted this. You can read the full story by going to the link on my Twitter. Alright, wasn't sure if I was going to show this, but I think I need to show it. I need to be, when I find out something like this, I think it needs to be shown right away, and there's enough credible sources out there talking about this that it needs to be shown. What is it I'm talking about? Another subvariant, an offshoot of the JN.1 subvariant. JN, this time it's called JN.123. And yes, there are some evidence that it exists in Brazil, and it looks like there may have been a case of it found in the United States, but I'm not seeing what state that is coming from at this time. But the bad news with this is it does look like it is a strong contender to be something that may be of significance. We'll have to see. It's very early in the game. We don't want to get into too much speculation. It always feels like a risk to me to even mention about these new sub-lineages so early in the game. We've seen a couple of them lately. We just know that there have been 4 samplings of it so far in 4 countries, I should say. It's in 4 countries. That's all we know so far. We'll have to keep following it. It may be something that we talk about going on into the future. Just wanted to make you aware of that. Taking a look at air quality for today. Yikes, not good at all. In the east, generally from Georgia on north to the Great Lakes. Look at all this red and orange. Really a bad air quality day. Across the central portions of the United States, not doing too bad, and the usual suspects out on the west coast in California. If you want to learn more about climate, weather, and that sort of stuff, I do have another channel where I just do that. It'll be linked down below. It is called Climate Data Report. Today we're talking about the forecast going into the weekend, and then the potential for a multi-day severe weather threat for next week. That'd be on Tuesday and Wednesday across portions of the midsections of the country through Kentucky. Yep, there could even be isolated tornadoes with that. You'll learn more about that over on that channel. Philadelphia yesterday had 743 EMS incidents, slightly higher than the day before. Let's do a live look at the Philadelphia suburbs and see what's happening. And it looks like we do have some calls on going to Montgomery County right now. And yet again, it seems like day after day, when we're doing these updates, there is always a cardiac arrest call sitting there. And there's one in Montgomery County right now. Taking a look at what's going on in Chester County. Let me refresh this to make sure it's up to date. And I see a lot of falls listed here. I see a stroke, a sick person. So there are some calls to be had in Chester County right now. Never a good thing. BioBot this week, as you can see here, went up ever so slightly for COVID. And now let's take a look at a few wastewater sites around the country. And I think it's best that we start off today in New Jersey, since we're talking about that norovirus risk. Let's take a look at the Bridgewater wastewater facility in New Jersey. Let's see what's going on there. COVID at this time was dropping. It's leveled off ever so slightly. Still dropping, though. RSV is slightly rising again. Both that and COVID are still high. Influenza A is low at this time. It's saying high, but look at the chart here. It has really dropped to much lower than where it was back around the holidays. Influenza B, though coming up low, is rapidly rising at this time. Norovirus was rapidly rising. Then it looks like it may have peaked and now is starting to drop, but it is still listed in the high category at this time. Let's see. Any detections of... Oh, we got an MPOX detection on February 12th. That seems to be a popular date for MPOX detections. We've been seeing that on multiple wastewater sites across the country. Let's continue on here. We want to look at some more wastewater sites. And I say we should do another one in New Jersey. How about we go up to Newark? What is going on there in retrospects with wastewater? COVID, high but dropping. RSV is high but dropping. Influenza A is high but flat. Influenza B is high and, whoa, continuing to rise even higher. Norovirus is rising ever so slightly at this time. HMPV, look at this. HMPV, it was flat, but then it went zoing. Yeah, it went up a good bit, and now it's trying to drop on the most recent update. And again, look at this. Another detection of MPOX. We're seeing quite a few wastewater sites lately with MPOX detections. What's that all about? Could it be a data thing? I don't know. Let's continue on here. Let's go slightly further west. Let's see what's going on. How about down in Louisiana? Is Louisiana dealing with a wastewater issue for norovirus at this time? I know it's a different region, but hey, it's something to look at. COVID it's dropping. That's a good thing. It's still high, but it's dropping. Low RSV levels. Influenza A rose ever so slightly. Influenza B dropped a little bit. Norovirus, wow, yes, Norovirus is really taking off down in New Orleans at this time. Look at this. It started rising back in January, it leveled off, and then right around January 29th, it really started to rise. And take a look at hepatitis A here. There's some detections of that, and yet again, this is 3 in a row now. 3 for 3 for Mpox. That's not good. Let's keep going until we find a site that does not have Mpox. I don't think that will take too long. I think we're eventually going to find a site with no Mpox. How about Akron, Ohio? And there's a reason why we want to look here. Let's see what's going on with the flu activity. Akron at this time, COVID is high but dropping. RSV is dropping a little bit. Influenza A is dropping for so slightly. Still high though. Influenza B, it's risen a little bit. Yeah, there's been a rise in that. Trying to flatten off. It's still high though. And Norovirus, look at this. Yet again, Norovirus is rapidly rising. Hepatitis A, there is some issues with that. And yet again, February 12th, we see another detection of Mpox. What is it about that date? That's 4 sites now. So we're going to keep going again. We're going to go until we do not see an Mpox case. And let's see here. How about we go to what's going on up here in Amarillo, Texas area. And we'll take a look at this site if we can. We see not calculated for COVID, so we don't know what the actual level is, but I can tell you this much. It has dropped. RSV rising just ever so slightly. Influenza A is low. Influenza B is rising ever so slightly. And we do have a detection at this time of hepatitis A. And look at this. Yet another detection of Mpox. I'm thinking this is a data issue with the wastewater scan site because that's what, 5 wastewater sites now? Let's just do one more. If we see Mpox, we see Mpox. And I really think, again, this is likely a data issue. Let's go out to Los Angeles. Let's go to like the northwest side of Los Angeles. I want to see what's going on there. COVID, low. And you can see here, RSV is low, influenza A and B is low, although influenza B slightly starting to rise. And taking a look here, we do see detections of hepatitis A, and yet again, another detection of Mpox. Yep, we're going with they're having a data issue. It just seems very strange that on that date, on every wastewater site that we click on, has a detection of Mpox. How about Memphis, Tennessee? I'm curious. If I click on here, will we see a detection of Mpox? Yep, yet again, February 12th. Seems like it's just every wastewater site. So that is really strange. It also makes their data a little suspect. You know, seeing that you have to wonder now, is their data going to be reliable going forward? All right, let's take a look at today's Walgreens numbers. We're just going to take a look at the national number here, if it will come up. And there you have it, 24.1% positivity. This update's on Mondays. The prior week was 26.2%. That's a difference of down 2%. And total tests, 15,930 versus 24,815. That's a pretty big drop at this time. Here's another look at wastewater. You can see Texas, very high COVID and wastewater. Oklahoma, very high COVID and wastewater. Virginia, Tennessee, still very high. Pennsylvania is high. And look at this. South Dakota still very high. Washington, high. California continues to be high. We'll get another update out of this again tomorrow. Vermont continues to be high for COVID and wastewater as well. And taking a look at this. Deaths here across the United States. They have leveled off, but there's still a few states that are still rising at this time. 21,373 hospital admissions. Again, all CDC data should update tomorrow. Hopefully, anyhow. Epidemic status. Yeah, it's growing again for COVID and influenza in multiple different states. Taking a look now, the JN.1 variant does lead the way at 96.4%. Again, JN.1 to 3. That's something we're going to watch. It's not going to be showing up here anytime soon, but that's something we have to keep an eye on. All right, taking a look at New Jersey today. 614 people in hospital, 69 out of 70 hospitals reported, 28 people on a ventilator, 74 people in the ICU, and discharges at this time. There were 79 discharges today in New Jersey. New York State. I would like to show you New York State, but let's refresh this again. Yeah, it's not updating. These are the same numbers from yesterday. Although it says data, updated on 22nd, which is today. So we're going to skip over hospitalizations there because, again, it did not update. Taking a look at what's going on in LA, and this has not updated yet either. Hopefully we get an update out of them by the end of today. Now taking a look at Colorado. Hospitalizations, they dropped to 122. Cases are down as well, 1,694. That's down by 216. Then we come to some mixed news. And this was kind of to be expected, but Chicago, your hospitalizations, average daily they're up to 18. Bed use is down slightly. Emergency visits are up slightly. Deaths are also up slightly. Your cases are still down, but I stress to use caution with this because let's go backwards for a moment here. I stress caution because we've been watching some of the wastewater data in the Chicago area, and here's the wastewater site one right here. Look at Cook County. This is a big wastewater site, 1.1 million population. You can see here it has gone up somewhat. So we would expect to see these numbers up in the data dashboard for Chicago. Cases, maybe there's not enough testing going. I don't know. But the wastewater suggests otherwise. And when you have wastewater coupled with rising hospitalizations, it's a good indicator that transmission somewhat has increased again in the Chicago area. Taking a look now at Washington State, we can see emergency department visits for COVID, influenza, RSV down. Admissions for all three of those are down as well. However, the number of people in the ICU for influenza is up slightly to 11. COVID is down to 32. That is down by 2 at this time. Also, we can take a look at what is going on in Massachusetts. 14.1% of emergency department visits during the last week were for respiratory disease, and influenza level right now is at moderate. COVID emergency department visits are low, and COVID-19 hospital admissions are low at this time. Alrighty, folks, that does it for today's pandemic update. Hopefully you have learned something out of this. I learned something as well. We might have to start becoming suspect to the data coming out of wastewater scan. Very odd about all those Mpox detections. Right on the exact same date at every wastewater site that we click on. We'll have to see what comes out of that. Hopefully, maybe we'll learn as to why that is happening. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you want to help the channel grow and help more people get informed, by all means, share this video. If you want to help support the channel, you can do so down below with multiple different links, which does now include PayPal. I've had a request to add a PayPal donation link, and you know what? I did it. So that's it for today. Hopefully you enjoyed this video. I will see you all again next time. Until I see you again next time, stay safe everyone, and have a fantastic Thursday evening. Thanks for watching.